Skin cancer in the tropics is extremely common. Townsville is probably the skin cancer and melanoma capital of the world. So we see a lot of patients regularly presenting for treatment of skin cancers. The sort of things that one would normally look out for would be lumps on the skin, ulcers on the skin, and particularly lesions that might bleed or itch or be painful. These sort of lesions, if they don't clear up within a few weeks, one would normally be suspicious that these might be skin cancers. With regard to moles, the signs that one would normally look out for that might raise suspicion would be the changing appearance of the mole. This might be an increase in the size of the mole. It might be an increase in pigmentation or change in coloring of the mole. That is, different types of pigmentation might be present in the mole. Bleeding is often a sinister feature. So these might indicate that a mole is becoming malignant, that is, it is turning into a malignant melanoma. A small simple skin cancer involves merely a simple excision and careful suturing. The wounds would normally be healed within a week or 2 weeks, and there is usually minimal discomfort to the patient and minimal aftercare. Larger skin cancers, particularly if they are in awkward positions, for example on the lip, the nose, the eyelid or the ear, might require more extensive surgery and reconstruction with some type of skin flap or perhaps a skin graft. Depending on the actual extent of the surgery will determine, of course, the patient's post-operative symptoms with regard to pain and discomfort, as well as perhaps time off work and aftercare with regard to dressings and nursing. Patients who have had major reconstructive surgery might well be off work for an extended period. People, particularly in the tropics, should be aware that they are at risk for developing skin cancers and melanomas. And the message is that anything that looks suspicious should be investigated. I would encourage people to visit their GPs if they have any suspicion about a lesion which has failed to clear up within the space of a few weeks, and their GPs would be well qualified to make the diagnosis of skin cancer, and if necessary they would be referred to plastic and reconstructive surgeon.